This patient was referred to me for endodontic retreatment of tooth number 3. Patient had pain. There was also a buccal parielis and sinus tract associated with the tooth that I will show you shortly. This root canal was done by an endodontist 7 years ago. According to the patient, the endodontist had gone through her existing crown and done this root canal for him. So a few days ago, tooth started to hurt, and then she noticed a swelling blister, as she called it, above the tooth. She went and saw her dentist, and her dentist told her that she needed to come see me. Here's the tooth. As you can see, endo access was made by the previous endodontist through the crown, and there is a filling composite restoration here, and you can see the buccal parielis and sinus tract that's associated with this tooth right there. Patient said it was a large blister, and then he popped, and now it's turned into kind of like an ulcer, like an ulcerated wound. Do I need to get a CBCT for this tooth? I do not. But if you do, by all means, go ahead and get a CBCT. I don't need a CBCT. I don't need to charge the patient $300, $400, $500, $600, $700 for a CBCT, expose the patient to extra radiation. I don't need that. All I need is a couple of different angulation PAs. And let me show you. This is one angulation. And in this angulation, you can see the large periapical lucency that's associated with the mesial root. Distal buccal. Palatal seems to be okay. Let's look at this angulation. And in this angulation, you can clearly see the missed MB2 right here. So I don't need a CBCT. All I need is a couple of different angulation PAs, and I can see the missed MB2. So this endodontist who did this root canal, unfortunately, missed an MB2 system, left necrotic tissue and bacteria behind. And of course, there's a periapical lucency here, periapical lucency here, as you can see. So we discussed options with the patient. The patient wanted to try to see if tooth could be saved. And that's what we did. We went through the previous endo access that was made by the previous endodontist, removed the build-up material, and let's go ahead and look at the clinical point of view, step by step, retreatment of this tooth, and let's discuss things. All right, very good. So rubber dam, of course. No rubber dam, no endo. We use a much thicker rubber dam when it comes to retreatment cases because I use chloroform to dissolve the gutta percha to remove it. So this type of rubber dam is very resilient to chloroform. All right, rubber dam is on. My assistant is cleaning, disinfecting the tooth and the rubber dam clamp and rubber dam itself by 70% isopropyl alcohol. And let's go ahead and get started. I'm using a cylindrical end cutting diamond burr here. My assistant to the right is blowing air on the mirror. My assistant to the left is suctioning. 6-handed endodontics. So I'm basically going through the previous endo access, removing the buildup material right now. Under the surgical operating microscope, of course. As you can see, that's when I had the Zoomax. I fast forwarded a little bit. All right. We hit gutta percha. As you can see, I used the brushing technique with the diamond. So that way, as soon as I see gutta percha, I can stop. I want to preserve as much dentin as possible, of course. All right, so that's what we have. And now I'm using my Endo Explorer to see what we got. There's a little piece still there. As you can see, there you go. I flaked it off. And look, I really didn't even need to do much digging, and I can already see the missed MB2 there. There he goes. That was the MB1. This tubercle, I'm removing some of the coronal gutta percha right there from the distal buccal. And you saw the color of the gutta percha. It was gonna turn black. So that tells me that there was also coronal micro leakage, and that's the MB2, the orifice of the MB2 right there, as you can see. Let's clean this up a little bit more, gain straight line access into the canals. So I'm using a smaller diameter end cutting diamond burr here. And cleaning everything up. My assistant is blowing air into the pulp chamber. I'm just doing cleanup right now, just getting all the walls smooth so the light from the microscope doesn't scatter all over the place. There you go. My assistant is suctioning for the patient, suctioning her saliva. All right, that's the palatal gutta percha, and you can see how dark it's gotten. It's gotten pretty dark. You can see that. MB1 and MB2 right there. All right, let's go ahead and put some chloroform, fill the pulp chamber with chloroform, and let's start removing gutta percha. And I'm using my M4 reciprocating handpiece. There is a number 15 C file in it right now. And I'm going to use this technique to remove the gutta percha from within the canals. My assistant is cleaning around the tooth a little bit. There's a little bit of gingival bleeding. Where the rubber dam clamp meets the gingiva. All right, I asked my assistant to give me a number 20. As you can see, that's a number 20. It's an old number 20 Pro Taper file that I'm using right now to just remove the coronal portion of the gutta percha. And right now I'm in the distal buccal canal just to get things going. I'm in the palatal canal right now, and again doing the same thing while the pulp chamber is filled with chloroform. Let's go ahead and add more chloroform. There you go. Let's go back in with the old number 20 Pro Taper file. This is not reciprocating. This is basically just a endo motor right now that I'm using in a rotational fashion. I believe I have the file. The RPM is running, I believe, at 400 RPM right now. I'm just trying to remove the coronal portion of the gutta percha so I can remove the rest of it. There you go. I'm filling the pulp chamber with chloroform again. All right, let's go back with the number 15 C file, and that's my reciprocating handpiece, the M4 reciprocating handpiece. All right, I'm removing the gutta percha from the MB1 canal to my estimated working length. My assistant gets the estimated working length from the PA radiograph. There you go. And I believe the estimated working length was 20 millimeters, and I reached 20 millimeters in the MB1 canal. I'm gonna go to 20 millimeters in the distal buccal canal. There you go. Yep, I got it. I haven't even started working on the MB2, by the way. I'm just removing the gutta percha right now from MB1, distal buccal and palatal canals. There you go. And let's go to palatal. Because the gutta percha had turned black, that means that there was coronal leakage. I decided to just go ahead and treat the entire tooth. If the gutta percha in the palatal canal was nice and pink, I would not have retreated the palatal root. But because the gutta percha, everything was dark, black, the gutta percha had turned black, I decided, even though there was no periapical relucency associated with the palatal root, I decided to just go ahead and retreat the palatal root anyway. Very good. As you can see, we removed the gutta percha from the palatal canal also. My assistant is suctioning for the patient again. All right. I'm gonna go ahead and get the estimate. We had the estimated before. I reached the estimated, and now I'm gonna go ahead and get the actual working length. I'm using the FinePix apex locator here by 8 teeth, as you can see. And that was the MB1. Let's see what it is. My assistant will tell me. I'm going to give the file to my assistant, and she will tell me. I'm getting the working length for the palatal canal right now. I fast forwarded a little bit. You already know this step. All right. I'm going to go ahead and use chloroform again. And now this time irrigate with chloroform a little bit. Remove the dissolved gutta percha. Leave some chloroform in the canals again. As you can see, fill the pulp chamber with chloroform. And the working length for the palatal canal and MB1 and DB canals were 22 millimeters, and that's why I'm using the number 15C file measured to 22 millimeters. And that is a number 15C file in my M4 reciprocating handpiece, and I'm putting it to 22 or 23 millimeters right now in the palatal canal, while the pulp chamber and canals are filled with chloroform. All right, now this is isopropyl, 70%. I use isopropyl 70% to, right after I remove most of the gutta percha. What it does is that isopropyl alcohol and chloroform and gutta percha mixture create clumps of gutta percha. That way I can easily remove the remaining gutta percha from within the canals. I'm right now using a number 20 flare file attached, that's a stainless steel file, attached to my M4 reciprocating handpiece. And I'm using it in a brushing motion, as you can see, brushing motion and removing the gutta percha. There you go. You see that big clump of gutta percha that came out? Yeah. That's how gutta percha comes out when you mix the, there you go. That's another piece right there. When you combine, mix chloroform, gutta percha mixture, and isopropyl alcohol, it clumps up the gutta percha chloroform. And you can now use, I'm using a reciprocating handpiece in my M4 to remove these clumps of gutta percha. And now I'm using a cotton pellet soaked in 70% isopropyl alcohol to clean the pulp chamber walls. There you go. That's a piece of gutta percha right there. That's another piece of gutta percha. Just cleaning the canal walls, the pulp chamber walls, I'm sorry. I haven't even started on the MB2 yet, by the way. Much better. Much, much better, as you can see. All right, let's go ahead and irrigate now with 6% hypo. That's 6% hypo. There you go. Bits and pieces of gutta percha are coming out. As I've said before in previous videos, the great thing about the M4 reciprocating handpiece and the stainless steel K-files that go in it is when I run the reciprocating handpiece at 1000 RPM, it not only instruments and shapes the canals for me because I instrument with them and also it use the files in a brushing motion, it also activates the hypo sonically. All right, I'm trying to see if I can get a number 15C file in the MB2 canal. Now that I've seen it, I know where it is. I asked my assistant to give me a number 8. That's a 08C file attached to my reciprocating handpiece. And let's see if we can put that 08 C file in the MB2 canal. It goes very nicely to our working length in the other canals that I worked on. That MB2 we need to work on. So I'm just going to use a very thin end cutting diamond burr and just remove a little bit more of the dentinal shelf. That's kind of blocking the entrance to the orifice of the MB2 canal. That's what I'm doing right now. Hypo, 6%. The 08C file, again, in my reciprocating handpiece that I'm running at 1000 RPM with torque off. Let's see if we can put that C file in the MB2 canal and get some traction. As you can see, I'm using it in a push-pull and brushing motion. Push-pull and brushing. See if you can open that MB2. And there you go. There you go. It's opening up. Irrigate again. Copious irrigation throughout the endo retreatment with 6% hypo. And you can see the orifice of the MB2 right there. Let's go back in with the C file again. That's again, 08 C file attached to my M4 reciprocating handpiece that I'm running at 1000 RPM with the torque off. All right. Just very, very slowly, very gently advance the file while it's reciprocating. There you go. There you go. It's opening up. I'm activating the 6% hypo. I'm using this 08 C file in a brushing motion. Push, pull, brush while the pulp chamber is filled with 6% hypo. I'm going to my estimated working length right now in the MB2 canal. You see how easy it was to locate the MB2? I located it right away, immediately, once I removed the buildup. The MB2 orifice was right there, so I'm very surprised that this endodontist missed that MB2, that obvious MB2. But it is what it is. Sometimes we're human beings. We're not perfect. He didn't miss the MB2 intentionally. But as you can see right now, I'm going to my working length, estimated working length in the MB2 canal with the 08C file. Push, pull, brush. Push, pull, brush. Pull out the debris. There you go. Very nice. All right, let's irrigate again with 6% hypo. All right, let's now go in to the MB2 with a 10C file attached to my reciprocating handpiece that I'm running at 1000 RPM with the torque off. And going to estimated working length. That's a 10C file. Again, attached to my reciprocating handpiece. Again, push, pull, brush, push, pull, brush. All right, let's go ahead and irrigate again with 6% hypo. Let's try it. And let's go ahead and get our working length. The MB2 working length. Again, I'm using the Fine Picks Apex Locator by 8 teeth. And let's get our working length for the MB2. All right, back in now that I have the working length for the MB2. Now I'm going back in with the C file again. Number 10 C file attached to my reciprocating handpiece that I'm running at 1000 RPM with torque off. To our actual working length now in the MB2. Push, pull, brush, push, pull, brush. Not only instrument and shape the MB2, but also activate the 6% hypo sonically. We're gonna irrigate. We're gonna irrigate again soon, but I just wanted to make sure that I got the working length correct in the MB2, so I'm using my Fine Picks Apex Locator by 8 teeth again, and just confirming and reconfirming my MB2 working length. There it is. I'll have my assistant read it again just to confirm it. What is that saying? Measure twice, cut once. Very good. You can see the MB1, MB2, distal buccal and palatal canals. MB1, MB2, distal buccal and palatal. Okay. All right, very good. The working length for the MB2 turned out to be 22 millimeters, and here it is. I got my number 15 C file attached to my reciprocating handpiece that I'm running at 1000 RPM with the torque off. I went to the MB2 to our exact working length, distal buccal right now. And we're going to irrigate again with 6% hypo. You can see the MB1, MB2. And take a look. There was also a DB1 and there's a DB2. You can see that right there. That's the DB2 right there. And palatal, of course. So this endodontist had also missed a DB2 canal. I'm in the palatal canal right now. To my working length. You can see MB1, MB2, distal buccal and palatal. You can see the DB2 also. All right. I believe here I'm using the eFlex S series of NiTi files manufactured by 8 teeth. And again, irrigating with 6% hypo, MB1, MB2, you can see that right there. MB1, MB2, and DB1 and DB2, and you can see the palatal also, all right? So, eFlex S. These are the eFlex S NiTi files by 8 teeth. Again, up and down brushing motion, brushing away from the danger zone. Let's go ahead and irrigate again. You can see DB1 and DB2 canals right there. MB1, MB2, palatal. Irrigating right now with 6% hypo. All right, let's go back in with our eFlex S files, and you can see a clump of gutta percha came out of the palatal canal right there. Again, you can see up and down brushing motion. I'm not forcing the file. I don't want to break a file. And let's go ahead and irrigate again with 6% hypo. You can see all kinds of gutta percha is coming out of the canal, the palatal canal there. There's a bit of gutta percha stuck in the palatal canal. I'm going to remove it. MB2, DB1, DB2, and palatal, as you can see. All right, let's go ahead and go to the next file. Again, I'm in the palatal canal, and I'm using the file in a brushing motion. Up and down, and brush to our working length. Let's go ahead and irrigate again with 6% hypo. And you can see that gutta percha that's kind of stuck there in the palatal canal. I'm going to remove it. But you clearly can now see MB1, MB2, DB1, DB2, and palatal. All right, here I'm using my etch file, just a regular etch file, and I'm basically trying to grab that gutta percha that's stuck in the palatal. There you go, it came out, as you can see. That's just the etch file attached to a file holder. There you go. That's another big piece that came out. There you go. All right. All right, I'm doing the same with the DB1, DB2 canals. Very nice. As you can see, okay, let's go ahead and irrigate again with 6% hypo. All right, very good. I'm in the palatal canal right now. Very nice. I'm just irrigating with 6% hypo. Excellent. I'm using ultrasonics now with hypo. The pulp chamber and canals are filled with hypo. I'm using ultrasonics right now to just clean things up a little bit more. Just make sure we got everything nice and clean and smooth. Very good. Just ultrasonically cleaning the pulp chamber floor, walls, and canal orifices. And also activating the hypo ultrasonically. All right. I'm using 2% hypo right now and ultrasonically activating it using a scalar tip attached to my Ultramint Pro ultrasonic unit. I love this unit, this ultrasonic unit. It's made by 8teeth. It's called Ultramint Pro. I've made a whole bunch of videos, even unboxing and how to clean it and maintain it and what have you. I filled the pulp chamber with 2% hypo and I'm ultrasonically activating it right now and cleaning the pulp chamber walls, floor, and the canal orifices, as you can see right there. Doing an inspection just to make sure we're not missing any anatomy like the previous endodontist. And look how nice and clean everything looks. Very nice, very clean. Look at that. All right, let's go ahead and fill the irrigate with 6% hypo again. You can see how many times and how much 6% hypo we use throughout the procedure. Copious amounts of 6% hypo. Very good. All right, let's go ahead and go back in. I believe this is my orifice opener. Yes. Orifice opener that comes in the packet of the eFlex S types of files by 8teeth. Let's just go ahead and flare these canals a little bit more from the coronal to middle of the canals with these orifice opener, with this orifice opener. Irrigate again with 6% hypo. Copious amounts of 6% hypo is used throughout the procedure, of course. It's all about irrigation and activation. People tell me, how do you fill all these lateral canals? And here I'm trying to test to see if MB1 and MB2 join. So I'm using my microsuction, suctioning the MB1 hypo to see if the MB2 canal will be depleted, but that didn't happen. That means that MB1 and MB2 are separate. I'm just removing the hypo and doing a final inspection. Just to make sure that I haven't missed any anatomy. I'm going to dry the canals. These are sterile paper points. MB1, MB2, as you can see, nice and clean. Once I open the DB1 and DB2, as you can see now, DB1 and DB2 join. So they became one. They became one canal. As you can see, before you saw two canal orifices, but once I opened the canals, you can see MB1 and MB2 join. I mean, DB1 and DB2 join. MB1 and MB2 are completely separate. Look, I blew a little bit of air, and lo and behold, we got some drainage from the MB2 canal, the canal that was missed. Now, some people believe here that we should just go ahead and not obturate because we got some drainage from the one of the canals. But if I can stop that drainage, I can complete the endo retreatment in one appointment. So I'm, again, going back in and irrigating all the canals one more time, copiously with 6% hypo. And I'm thinking now to myself, I shouldn't have used air, even though the air is not full blast air, is attached to a Stropco connector, which reduces the air pressure by a lot. But I'm thinking right now, why the heck did I use air? I shouldn't have used air. But anyways, okay, all right. Let's go back in and see if we can get this root canal retreatment completed. If I get persistent drainage, of course, I will not complete the endodontic retreatment. I will place calcium hydroxide in the canals, pack the canals with calcium hydroxide, temporize the tooth, and schedule the patient to come back in a week. As I said, if there is persistent drainage. If the drainage stops, and I'm going to confirm that by placing multiple sterile paper points to our working length and inspecting the tip of the sterile paper point to see if it's wet. If it turns out to be wet consistently, then I'm not going to obturate. As I said, I'm going to go ahead and place calcium hydroxide in the canals. Right now, I did that, and the paper point came out dry. Sterile paper point to working length in the palatal canal. I'm going to test the MB2 one more time with sterile paper point. And look, it's nice and dry. No drainage. All right. I'm going to place my AH Plus sealer. MB1 now. Just coat the canal walls. I'm going to use the injection technique of gutta percha here. All right, let's go ahead and obturate the MB2 canal. I'm using the injection technique of gutta percha. I'm using my Obtura 3 Max gutta percha gun. Please don't do this. Don't do what I'm doing right now. Don't do it. You're going to extrude so much gutta percha out of the canals if you don't know what you're doing, into the periapical region. If you don't know what you're doing, don't use this technique. I'm begging you, don't use this technique. I've practiced on, I would say, maybe 1,000 extracted teeth during my residency program and thereafter to master this technique. I'm obturating the MB1 right now. I obturated the MB2 already, as you can see. Obturating the MB1 right now with this injection technique of thermoplasticized gutta percha using my Obtura 3 Max gun. Don't use this technique. Don't do it. All right, so I'm using my Buchanan number 2 plugger and condensing the gutta percha, keeping some pressure on the thermoplasticized gutta percha to make sure it penetrates into the complexities and lateral canals if present. All right, let's go ahead and put some AH plus sealer in the DB canal. Coat the canal walls with AH plus sealer and put some sealer in the palatal canal. Coat the canal walls with AH plus sealer. All right, let's go ahead and obturate the DB canal, again with the injection technique that you're not going to do. You're not going to use this technique. You're going to use your gutta percha cones. And I've done multiple videos on that technique also, the warm vertical obturation technique. So you can go and watch those videos. Topping off the gutta percha in the MB1 canal. And the MB2 canal. And now let's go ahead and obturate the palatal canal using my Obtura 3 Max and thermoplasticized gutta percha. You're not going to use this technique. Don't use this technique. I don't know how many times I'm going to tell you this. I need to tell you this. And we're pretty much done. I'm just going to, next, I'm going to clean up. I'm going to condense, of course, the thermoplasticized gutta percha. And I'm going to clean the pulp chamber with a cotton pellet soaked in 70% isopropyl alcohol. I'm going to place a sterile sponge in the pulp chamber, and I'm going to temporize the tooth with Cavit. That's basically it. I'm not going to show you the rest. It's pretty straightforward. So let's go ahead and go to the post-op radiographs and see how we did. Condensing the gutta percha in the palatal. And I'm going to top it off. And that's it. Clean the pulp chamber with 70% isopropyl alcohol, cotton pellet, and sterile sponge. Goes in and Cavit. And we're done with the root canal. The girls are going to clean the patient up and give me some post-op multiple angulation PA post-ops. All done in under 1 hour from start to finish. Retreatment of tooth number 3. Previous endodontist had done the root canal about 7 years ago. As you saw, he had gone through the porcelain crown and done the root canal, and he had unfortunately, unintentionally of course, missed an MB2 and a DB2 canal. So this is what we had started with. As you can see, previous root canal by the endodontist, missed MB2 right here and DB2. And here's the post-op. And take a look at this beauty. MB1, MB2. Look at that. Look at that. Look at all of this anastomosis between MB1 and MB2. Look at this area right here. 1, 2, 1. I mean, there's so much anatomy here. Let's look at another angulation. This is another angulation. Look at all of this anatomy. So much anatomy. Look at all of this here. And palatal, of course. Another angulation. There's so much anatomy here, as you can see, that was missed. And these anatomies, these complexities, harbor necrotic tissue and bacteria. And another angulation. So you can see how important locating all the canals are, how important our irrigation protocol is, how important our activation protocol is, how important at the end our obturation protocol is. And look at all of this anatomy that was missed, that we were able to locate and address three-dimensionally. I mean, just pause and take a look at all of this anatomy that was cleaned, disinfected, and then obturated three-dimensionally. All right, so very good. Hope you enjoyed this video, and I've posted so many POV clinical videos. So please go ahead and watch those. Make sure you subscribe, or you have subscribed. I have many people who watch these videos without subscribing to the channel. So please make sure you do that. Make sure you subscribe. Make sure you hit that like button. Make sure you make a comment. And see you guys in the next video. Goodbye.